This week on the Healthcare Experience Matters podcast, we're gearing up for a November full of leadership certificate program opportunities from the Healthcare Experience Foundation by featuring this best of episode. You're about to hear snippets from previous podcast guests that quickly dives right into the essence of what defines effective healthcare leadership with 2025 right here on the horizon. Look in the description of this podcast episode for more information on attending one of these virtually held leadership certificate programs, and hopefully we will see you there in November. First up, we hear from Carla Parker Hollis about leading with authenticity. Carla is the Chief Operating Officer of Jersey City Medical Center at RWJ Barnabas Health, and she's interviewed by Kathleen Lynham. She's an executive coach here at the Healthcare Experience Foundation.
So the topic this session was authentic leadership. So tell us about, your feelings about the difference between an authentic leader and perhaps someone who was not authentic. And have you had experience with others? Talk a little bit about the authenticity part.
Sure. Absolutely. And it's funny how, I reflect on the term authenticity or being authentic. And it's kind of become one of those catchphrases. We use it a lot, but I do think authenticity is really fundamental to everything that we do. And for me, it's both an internal and an external projection, right? I think if you're authentic, you're true to yourself, and you're true to your own set of values without wavering from those. I think others see that, they know that. I've certainly worked with individuals who I didn't believe reflected that, whose leadership sort of went with the wind, if you will, and not being grounded in what was, really being true to yourself and true to others. So, authentic leadership to me is paramount, and you know it when you see it. And you know it when you don't see it. And I've had experience with both. And it's one of the things that I think about a lot. And certainly, again, at the end of the day, if we're authentic leaders, we're being true to the individual that we are, and others know that.
And that was, we talked about that a little bit. It's hard to, when you're having incongruencies, when you believe one thing, but you're kind of called to do another. That's when truly an authentic person has to share their ability and say, yeah, this is hard for me too. So
absolutely. I think a good example of that is really around staff engagement. I mean, staff engagement isn't about a score. It's about what you do to engage your staff, right? And if you're only focused on the metric or what's behind the equal sign, then you're not authentically raising the engagement of your team. And it's just so important to focus on what's real, and everything else will follow.
Next up, we hear from Kathy Boswell. Kathy is a coach and national speaker with the Healthcare Experience Foundation. She explores the 4 dimensions and competencies of emotional intelligence and how they can help promote stronger, more inclusive healthcare leadership.
So when we look at emotional intelligence, there are 4 dimensions and competencies you want to look at. Number 1, immediately, is the self-awareness, looking at our own selves. The second thing is, though, in this personal competency realm, the self-awareness and the self-management. It means if I become self-aware of me, I can better manage my interactions, and I have more emotional self-control. I can become more adaptable when I walk into a room, when I'm in a conversation. I can have a positive outlook on things when I enter in, whereas other things might have made me uncomfortable. That's another thing I love. So discomfort is that flag of, you know what? I need to be aware that my biases may be rising. So here it is in this personal competence of self-awareness and self-management. That's the me. Then we can move into that social competence, because now that I have been able to learn, expand my knowledge, not necessarily become competent, but become culturally humble and understand cultural humility. Now it will influence me being socially aware to be able to demonstrate empathy, both with people and within my organization. And then it's going to allow me to really influence the relationship management side to where I am now more conscious about how I deal with the conflict, build the team, and inspire through leadership. So as I develop me, that means myself, I look inside, but then that outside view and understanding and growing allows me to take that knowledge and to become more of an ally to those around me and to my organization. So why do we want emotional intelligence in healthcare? And why is it so important? One is that it is going to allow us to be able to improve communication skills. It helps us retain the best of the best in people. It helps us reduce that malpractice risk. It helps us create a stronger patient experience, growing referrals because of the interactions. People see that difference. Yeah, we may be different, but I'm respected. I'm valued. I matter when I go into that space. And it builds that trust in that patient relationship.
And rounding out today's episode is our friend, Dr. Rob Minkus, a physician coach with the Healthcare Experience Foundation. He is a board-certified general and pediatric surgeon. He discusses how physicians can overcome the inherent challenges of recognizing themselves as leaders, and he's interviewed by yours truly, Casey Callanan, and I am the podcast director here at the Healthcare Experience Foundation. Talk to me about some of the common challenges that physicians are facing who are actually transitioning into a leadership role, and just, maybe that they have a lot of clinical experience, but maybe not so much leadership experience.
Identifying as a leader is a challenge, especially for physicians. And this has been studied in its document. We go into healthcare because we care about people and we want to help people. We want to heal people. Identifying as a leader is a whole different aspect. And we're all leaders in our training. We lead our patient and our care teams and our local care teams on the ward and in the office, but we don't identify as a leader. Healthcare Experience Foundation, we were working with Katie Owens, who's the president of Healthcare Experience Foundation. We were doing a communication program with a large group of hospitalists, and we're discussing leadership. And even those who are in formal leader roles, only 2 people in an entire room raised their hand identifying as leaders. So that's a real big challenge. What does it mean to be a leader? And what's so important about what we're doing, the skills that we develop are really just core human skills and align with almost all of our values as healthcare providers and clinicians. When we're aligned to a vision, we're able to do that. But that's particularly one challenge. And then learning what we've never learned before. If I'm putting my nose down and I'm a surgeon, I just want to get on with the business of being a surgeon. I've not paid attention, right, to what goes on at all of the other levels. And I'm not aware of how what I do and the decisions I make might impact other aspects of healthcare. And that becomes a challenge as well. But that's part of the fun of learning and growing and becoming lifelong learners in this, leadership and self-awareness journey.
Can you tell me a little bit more about how effective physician leadership directly can contribute to better patient care? Because that's kind of what we're all after here.
So in the environment of healthcare, there's so much frustration. And we see it manifest in lack of engagement and burnout, and imposter syndrome and perfectionism. And everyone's looking to physicians as leaders. And as physicians, we're diagnosticians. We can diagnose the problem. And then we go on and look for solutions. What this shift becomes for us is being solution driven. And this occurs by creating a collaborative culture, right? And this requires us to promote effective communication where we really prioritize patient-centered care. We talk about it often, but as human beings, right, we get tired, we get burned out. And we know it's important, but we don't always feel it. So by becoming aware of who we are, how our relationship is to others, and even the situation, we can really improve patient engagement, patient experience, and really enhance the clinical outcomes. And we also know that when we have great physician leadership who partner with nurses and nursing leadership, we reduce staff turnover, and we develop the skills even to intervene, right? We become proactive and not reactive to the situation. So there's a tremendous opportunity to really improve the environment and the culture that impacts all of our collaborative colleagues and our patients.